Welcome back. You tuned into Inspired Afternoons with me, Mariam Mia. And now I just received uh, a write up, and this is in collaboration with Greenside Oxygen, the initiative that is providing home based care, oxygen relief, as well as counsel during COVID in the Greenside Emerentia area. And many such initiatives have been set up in various areas. I just spoke to a sister, Leila Juma, and they currently setting up a complete support system in the Robertsham, in this area here where Solar Media offices are located in the Robertsham, Ormondy Ridgeway area. Lenasia has a setup like this. Various suburbs in KZN has a setup as as well in Lenasia, in Roshni as well. But another service coupled, so basically it's a holistic service that all health professionals are providing, including counselor services in an aspect I'm involved in. But Sister Mumtaz Gani, she's a biokinetic kinetist. And as a consequence of the COVID-19, many patients have diminished cardiovascular strength as well as muscle atrophy. And basically, muscles are gone stiff in it. Biokinetics can help to improve both of these and restore it to the level of pre-COVID. And really, this has been feedback that I've received from patients who, especially those that were hospitalized and needed oxygen, or even from based care, they required oxygen for a couple of days. They're still complaining, even it's been about 4 weeks and post COVID, they're still battling with anything cardio and difficulty in breathing. And hence, Sister Mumtaz Gani has now sent a post regarding biokinetic treatment for post-COVID patients. I'd like to introduce her. She's a biokinetic kineticist for 15 years. So she studied at Rao, which is now University of Johannesburg. She's always had a keen interest in health and fitness. And Alhamdulillah, that evolved into her passion, and her passion evolved into a career. She's a mom of four, and like all of us, I think we balance our work and family life as well. She sees a wide range of patients within the practice, and she prides herself in giving them undivided attention. And I think is each treatment is then focused on the particular individual's needs. So let me welcome Sister Mumtaz Gani. Assalamu alaikum and shukran for your time, Sister Mumtaz.
Walaikum salam. Thank you for having me, Mariam.
So Mumtaz, before we get there, I think in terms of treatment, in assisting in terms of therapy and getting patients back to normal health in terms of lung functioning and breathing and respiratory functioning, we know of physiotherapy. So please, can you explain to us what is the discipline of biokinetics? What does that involve and how does that differ from physiotherapy?
Okay, so I'm going to focus in terms of the COVID patients. So the physiotherapist will deal with them in the acute stage and probably even while they are still in the infection stage, to work on their lung capacity, to work on mobilization, that sort of thing, and their breathing as well. Biokinetics is focused on exercise predominantly. So we don't do the normal physio treatment. Our treatment is exercise based. And that's why we come in as post-COVID therapists, because it's once the patient has had some sort of recovery, so that we can now work on, like you mentioned, the muscle atrophy, the cardiovascular fitness, and particularly most patients have complained about the lethargy. And so the biokinetics will help in that as well.
Okay, because I've seen this, and I can tell you from somebody I know of, a close family member who was hospitalized for 10 days, was on the ventilator, needed the oxygen, and now it's been about 5 weeks since, I think about 6 weeks since the first diagnosis, and maybe about 3 weeks that he's now out of hospital, but maybe takes about 10 steps and then is breathless, finds it difficult climbing stairs out of breath, and like you said, very, very lethargic. And this was a very, very active person prior to him being COVID positive. So, like I said, I'm speaking from a personal observation of somebody who I knew post pre-COVID and now COVID and post-COVID. So, are you seeing more and more patients manifesting with such symptoms?
Yes, so it's starting to come up. I teamed up, so Zina Dadabai, the doctor Zina Dadabai, approached me to say, how can I assist? She knows that the physios are involved, and where do we fit in, and how can I assist? And so that's why we put this together and decided to offer it to patients, because like you say, the complaint is I'm just not getting back to my energy levels, I'm just not able to do my daily activity, or if I'm working, I'm tiring much quicker than I used to. And then the younger patients as well that were exercising even before, they are then complaining that they're not getting back to their cardiovascular fitness. So there's a number of factors to consider. First, I'll focus on the patients that have been hospitalized. So there's two things. Your lung capacity is reduced because of the infection, and this then affects your cardiovascular fitness. So it's your lungs and your heart. And then those that are not hospitalized, maybe not on oxygen, but they're still experiencing the lethargy. And both of these cases, the exercise will help improve that. The other thing, especially with your hospitalized patients or those that have been on oxygen, those that have been bedridden, is muscle atrophy. So basically, muscle atrophy is losing your muscle, or losing your muscle because you're lying down, because you're not mobile, because you're not doing your normal exercise or even just your normal daily activities, and you're losing muscle. Muscle wasting is happening during that period. And so we'll focus two ways. We'll focus on your cardiovascular fitness by doing cardiovascular exercises within what you can manage and build you up. And then we focus on muscle strength to work on the muscle atrophy as well.
Okay. So basically, you will assess each patient and then you'll design a program according to in terms of their stamina and what they're able to do.
100%. So there'll be a pre-assessment, and that assessment will include muscle testing to see if there is any muscle weakness. Then we'll also do a lung function, and then I've asked patients that if they've done an ECG or chest X-rays with their doctors to please come to the appointment with that. And then also we're working with the doctors. So there has to be some sort of clearance. If it was a patient that was in hospital, then I need to have the clearance from the doctor to say that they can go ahead. And then I have those results. We'll work with them for 4 to 6 weeks, and then we'll do a reassessment to see is there any improvement, where are we heading, and that sort of thing. The exercise is based, it's individualized, so it's per patient. So it's not a standard protocol. It's not something that I can send you home with and that you can do on your own, because based on the assessment, we will prescribe what is needed for that particular patient. And then we take you through the exercise session. So it's one-on-one. I'm there with you. You're not doing it on your own. And then, like I say, reassessment to see where we're at, and then change the program to build you up again. And then at that point, you probably are able to take home a program and do it on your own.
So in terms of the amount of treatments, you said in a 6-week space, in the amount of treatments that one would require in that duration, is it once a week or how does it work?
Okay, so again, it's dependent on the patient. It can be once a week, depending on the severity, but it could also be twice a week. And then the length of the session will again be based on what I find in the assessment. So it would either be a half-hour or a 45-minute session.
Okay, so it's about, like you say, half an hour to 45 minutes, but that will all be, and then also the duration will be, the frequency of and duration will be according to the individual patient. And so if somebody follows the exercises and comes regularly in that, in 6 weeks, you will then do an assessment, and inshallah, by then, if there's no major additional complications in 6 weeks to you in terms of prognosis, will the patient then be back to pre-COVID in terms of their respiratory, breathing, and health?
Okay, so not always back to pre-COVID. Some may, depending on the severity of the illness, but definitely some improvement, inshallah. So this is based on the guidelines that we normally work with in the practice, seeing other patients or non-COVID patients as well. So usually, for change to happen, it takes about 6 weeks, and that's why I've said that the reassessment will happen at around that time.
Okay. And look, this is because COVID is a very, very new virus, and health professionals, researchers, as every day we're learning something new about the virus. And I guess as time goes by, you'll also have enough information in terms of your studying the various patients that come see you, uh, what will work, what doesn't work in terms of what type of exercise will yield optimal and desired results. Because, like I say, this is very new for everybody, and every day you're learning something new about the virus. And can I just attribute that same way of thinking in terms of biokinetics as well?
100%. So even saying the 6 weeks, I don't know. I haven't seen a patient 6 weeks after. So I'm basing it on my experience. I'm basing it on treating patients previously. I'm also basing it on my cardiovascular patients and my pulmonary patients. So those are patients that have had either a heart attack or have any heart condition, have had heart surgery, as well as like your asthmatic patients, your patients with chronic obstructive pulmonary disorder, so those sort of things. And we see some sort of improvement after 6 weeks of that. My exercise prescription will also be based on how I treat these patients, because like you say, this is new for everyone in the field. It's not just new for us, it's new for doctors, it's new for the patient as well. So I'll use my experience based on the patients that have had heart and lung issues, but their recovery, their prognosis, their reaction to the exercise, we'll have to play it by ear and see how we go.
Yeah, like I say, we all have it's been a learning curve for everybody, I think, in all domains in the health industry in terms of understanding this disease and making sense of it. And like you say, uh, researchers spend years studying. I mean, if somebody was studying smallpox or something like that, even when the HIV/AIDS pandemic hit, it took about 3 or 4 years, even longer, in terms of understanding the disease, how it works, in terms of the treatments, prognosis, long-term diagnosis in terms of this, and your quality of life thereafter. And this is, I think, we only seen major increments in terms of the amount of disease, in the amount of those that are testing positive. I think from May, we then seen an increase with June, and I think now July, and they say August is going to be the peak. So it's a virus that's in its infancy in terms of us understanding it. And like you say, you offering this based on your experience, but you yet to see 6 weeks what results are going to be yield. But inshallah, I'd like to talk to you maybe in 2 months' time in terms of this, because then you will be working with post-COVID patients a lot more, and by then you would have a better understanding in terms of the type of exercises, or maybe you'll have to combine two. It's a time of us adapting and reinventing and being resilient. So you would have, maybe inshallah, Allah will use you as a means to say, you know what, you need to combine these two exercises here in terms of treating a COVID patient, and then that will be the Mumtaz Chauhan movement or something like that. I don't know. I'm just thinking off the top of my head that we'll have to name it after yourself, because you know what, we all trying to find solutions in terms of what will work in getting people, because I've been counseling lots of patients, and for them it's been an ordeal. So it's not like you have ordinary injury, you fractured a wrist or your ankle or something like this, and you know the cause of treatment. And in terms of you getting somebody, especially somebody is in the sporting field or that, and nursing them back to health so that they can play again or whatever, this is different. We don't know. And whoever I spoke to, they said it's not like a flu. I feel like my body took a battering, and I suffered an ordeal, and the whole way in terms of the isolation and that. So it's very new in terms of how we dealing with this. So inshallah, I'm really keen because it's very interesting in terms of you assisting in this capacity. So I'd like to chat to you maybe in 2 months' time, and you can just tell us how's it going, and encouragement for others that in terms of getting yourself back to nursing yourself to good health, there is intervention, and one of the avenues is by kinetics. And shukran for volunteering in terms of providing assistance with the green side oxygen and that, and much appreciated for your time, Sister Mumtaz.
Jazakallah. Thanks so much, Miriam. I'd definitely like to touch base again. We're seeing our first patients this week, so it would be great to see the progression and that sort of thing. And like you say, I mean, even each patient, you get a young patient that's quite severe, and then you get an old patient that has very mild symptoms. So we just have to take every day as it comes. From the beginning, I put my name down, to help in whatever capacity I could, medically or however else. And I'm glad that this came about because I want to be a part of this fight. I want to try and make a difference, inshallah, and help wherever we can.
Shukran, and may the Almighty continue to use you and the skills and knowledge you gained in the field of biokinetics to assist in, I think, our fight against COVID-19. Assalamu alaikum wa rahmatullahi wa barakatuh, Sister Mumtaz.
Wa alaikum assalam.
Okay, and we're going for a short break, and from providing community service and relief against the fight of COVID, we're going to be chatting to Brother Abdul Alalin from Islamic Relief, who is also challenging the fight against COVID by providing much relief and aid to those that find themselves in difficult circumstances. So after the break, Islamic Relief with Brother Abdul